And welcome back mga kasambahay to Doctors on TV. Still with us this morning, Dr. Gil Vicente, talking about head and neck tumors. Ang dami yung nababanggit na head and neck tumors. Nakakatakot. Ang daming symptoms na
Pero the good thing
babantayan.
about it, no, the brighter side naman, is meron talaga siyang minamanifest na symptom. Yes. Kahit pa paano.
Okay.
Bantayan lang natin yung 12 na yun.
Okay.
Pero minsan, pag may bukol na tayo, it can be a late symptom. Because pag may bukol na tayo, that could be a late stage na. That means stage 3 or stage 4.
Doc, earlier you mentioned yung pag-inom ng, not pag-inom ng antibiotics, pero yung infection, yung dito. May mga instances, Doc, na namamaga dito. Posible ba na talaga bang tumor yan o posibleng infection lang?
Pwedeng infection lang ito, lalo na kung masakit-sakit pa. Pag fairness mong ganun, may sakit. So, pwedeng infection lang to. No? So, as much as possible, we can give antibiotics, especially if it's just a few days. No? We can give antibiotic, we can try that. Tapos pag lumiit naman, di okay lang. Pero pag nag-persist ito, tumagal, pwedeng lumiit ito eh. Uy, magaling na ako, pero pagkakapainin, meron pa rin. So, pwedeng ganun na nangyayari. So, dapat talaga be aware. Again, we do further examination. It's not just endoscopy na gusto natin gawin. Ano yung sinasabi natin kanina, mas maganda rin para meron tayong peace of mind yung mga imaging techniques. Hindi na uso yung X-ray ngayon. Meron na tayong CT scan or MRI.
Okay.
So, yung MRI, lalo na, mas maganda to, lalo na sa mga maliliit na tumor at saka meron tayong mga tumor na soft tissues, pag soft tissue. Sa head and neck, marami kasing soft tissue tumors. So, mas maganda kung MRI ang ating ginagawa.
And are these treatable tumors? Kaya madali lang ba tanggalin to or mahirap na?
Yeah, pagka initial lang, mga stage 1 and stage 2, pwede naman. And stage 3 and stage 4 pa rin. Pwede pa rin, treatable pa rin naman to eh. No? There's always a positive thinking tayo palagi pag meron tayong ganito. No? And we also can cure them, no, maski na late stage. So, wag mabahala, pero wag mawala ng pag-asa pag meron tayong ganitong problema. Pero as much as possible, prevention ang ating importante.
Yes.
Now, to prevent it, yung sinabi namin signs and symptoms, be aware of those signs and symptoms. Pangalawa, pag talagang meron tayong ganitong signs and symptoms, go directly to a doctor acceptance ang importante natin na meron tayo. Merong iba hindi ina-accept eh. So, Hinahayaan nila. Hindi, gagaling rin yan. Kakain din ako ng ganito, mga ano lang ako. Tapos lang ako may lumaki. So, basically, prevention is very important. We can eat a lot of food, no? And nutraceuticals can help, no? Para lumakas tayo, lumakas ang immune system natin. Pero importante talaga natin, you should go to the doctor, to our ENT specialist, tapos masilip natin talaga properly.
Avoid tobacco, no? So, smoking.
So, avoid tobacco, avoid smoking, avoid irritating dentures, no? So, yung mga ill-fitting dentures, nakakagat natin yan eh. So, anything na nakakagat natin or persistent trauma can cause this kind of problem, no? So, tapos nga yung inverting cigarette smoking.
Okay.
Tapos, isa pa palang anuhin natin, siyempre, ngayon, meron tayo tinatawag na human papillomavirus virus.
Okay.
This has been related to oral cancer and laryngeal cancer.
Okay.
So, siyempre, safe sex.
Okay.
Safe sex, no? So, in order for it kasi marami na tayo nakikitang ganitong sitwasyon and even the likes of a famous Michael Douglas is advocating this, So, bin-advocate niya, dapat magpa-inject tayo, especially if we are sexually active.
So, dapat pati ang male
male pa rin,
vaccine ng human papillomavirus.
Human papillomavirus vaccine. Okay. So, yun ang mga natin dito, no? So, that's additional. Tapos, with regards to the reflux or hyperacidity, yung hyperacidity, like, avoid irritating food, no? Like coffee. Coffee can be good also, pero siyempre, pag sumobra yung coffee natin, na-irritate, tapos na-irritate yung salamunan natin. Anything na may caffeine, tea, sodas, no? And chocolate can be irritating do sa throat natin. So, spicy food can be irritating. Yung mga tomato-based food can be irritating. So, tapos yan, mga alcohol, siyempre. Alcohol can be irritating as well.
Kasi Doc, chewing tobacco. I think isang, yung mga kababayan natin, marami pang nag-chew ng tobacco. Tama ba?
Marami pa rin nagchuchu ng tobacco. No?
nga.
Tapos lalagyan pa ng amog.
Apog.
Apog. Apog na wala yung P. So apog. So yun actually yung paglagay pa ng apog, yun ang irritant talaga.
Okay. And that's known to increase
No to
risk
increase
for oral
further
cancer.
oral
Nako.
cancer.
Sa mga kasambahays natin dyan na hindi na nadadiagnose, bigla na lang nagkakaroon ng sugat sa probinsya, hindi na lang na-diagnose yan Iwasan daw natin, sabi ni Doc.
And if you get the symptoms, magpa-check up ng maaga kasi mas madaling gamutin.
Habang maaga pa.
Habang maaga pa, habang maliit pa ang tumor. Pag malaki na, mahirap na.
Hirap na.
Nako.
Ang apog daw, pampalakas kasi ng ngipin. Ikaw magkaka-cancer ka naman.
Mawalan ka rin ng ngipin.
Nanginay mo
Mawawala
ang
din.
katawan.
Okay, so Dr. Vicente, thank you very much.
Pero ako kayong book.
Si Doc merong, ito inahawakan ko na kasi uwi ko na ito. This is titled Facing Cancer with Care. Titingnan natin ito very friendly siya. Doc, can you tell us about your book?
Yeah, this is I'm the editor-in-chief of this book, special book for me kasi this is my first book na hinandle ko talaga several years in the making, no. So facing cancer with care, no, para sa mga caregivers, cancer survivors, and also for medical cancer specialists, no. So what's care, no? Facing cancer with care. Care, C is for compassion.
Alright.
A is for adaptability. We should be able to adapt. Pas kina tayo may cancer, dapat magaling tayo mag-adapt dito. Reassurance, no. It's all is not the end, no.
The end
So
of the world.
we would like to reassure you, pwede pa ring mabaliktad natin ang inyong mundo even if you have cancer. And E is energy. Always have that energy, always have that positive thinking, no. So we want to emphasize this. This is a special book for the layman. This is specifically for the layman. So it's comprised of 3 parts. Number 1, it tells us stories of cancer survivors and yung mga naging pasyente rin na nawala na rin dito sa mundo, pero they left us stories na talagang makabagdamdamin and very inspiring for all of us. No? Number 2, meron tong sinasabi dito na cancer support care, basically how to cope up with depression, how to have a more positive thinking. Prayer is very important, so we tell you how to pray. We tell you how to forgive. Kasi sabi natin, pagka nagfo-forgive ka, it's part of healing. No. So laughter also, being the best medicine. So it tells us also the exercise. It also has a book, a chapter on cancer and sex life. So very interesting, So it's not after all, pag may cancer ka, hindi ka na pwedeng magkaroon ng ganitong klaseng activity. So it can still be a very successful part of our life na ganito, no. So this one is available not yet in the bookstore, pero it's available with our office, in my office, no. So and also in if you want to have this is our secretariat is in St. Luke's Medical Center sa Cathedral Heights and room 805. Okay, with the number 724-5219.
Okay.
Also on kasi head and neck tayo kasi, no. So on from July 27,
Tomorrow.
okay, up to August 2, okay, then that's today, no. We had a long activity, long week, and we are celebrating the World Head and Neck Cancer Week.
All right.
Okay, so we enjoin you to be part of this. You can. We have actually opened up a head and neck forum in Facebook. You can join us there. You can interact with us, medical specialists. We invite you to be there also.
Very good.
Thank you
And Doc,
very much.
antayin namin yan Antayin namin ito.
Yeah,
And this will
eventually
be
sa mga
available.
bookstores.
Yeah, bookstores. And
Available
this
in
will be
bookstore.
available daw sa mga doctors
Sa mga
desk.
doctors. Doktora. Kaya ito na sa'yo.